Everyone needs access to healthcare, but just because a patient has been treated, it doesn't mean their condition will improve. In fact, when care is not of sufficient quality, treatments might not work or could even cause harm. Around the world, more deaths are due to poor quality care than lack of access to health services. 15% of deaths in low and middle income countries are caused by poor quality care. And in high-income countries, 1 in 10 patients are harmed while receiving hospital care. The need for action is clear. To make sure that health services provide quality care that improves people's health, care should be effective, so you accurately diagnosed and receive treatment that works. Safe, so the healthcare that you receive doesn't harm you. People-centered, so decisions made about your care are tailored to your needs and you're treated with compassion. And timely, so you receive care when you need it. It should also be equitable, so all people receive the healthcare they need. Integrated, so different health workers and facilities all work together to improve your care. And efficient, so available resources are used more effectively to improve your health and avoid waste. WHO is calling on countries to take action on quality of care and is working with them to develop policies and plans so that all patients are cared for in environments that have the right infrastructure and health workers are well trained and given the time, resources, and support to provide quality care. We're encouraging governments and health organizations to listen to the people and communities they serve, find new ways of relating and working together, and learn from failures and successes. WHO is also supporting countries to take early action on critical areas like maternal and child health, patient safety, infection prevention and control, and water, sanitation, and hygiene. While action on quality is needed around the world, we also have a particular focus on fragile and conflict-affected settings, where the need for healthcare improvement is often urgent. We are working with partners towards the Sustainable Development Goals, which stress that quality is a key element of universal health coverage. In the words of the WHO Director General, quality is not a given. It takes vision, planning, investment, compassion, meticulous execution, and rigorous monitoring, from the national level to the smallest, remotest clinic.
Assalamualaikum and hi everyone. Respected and beloved our lecturer Dr. Junaida binti Ismail and my fellow friends, today we would like to present our big topic, which is the health, and we choose the National Policy for Quality in Healthcare known as a NPQH as our policy. So, before we go through a detail at that part, I would like to introduce our team member first. My name is SYULIANA binti JAMIL, next NURKHALIDA binti KHALID, and then we have NURSYAZA ALYA binti Muhammad SYAUFI. Besides that, we also have one HAZIRAH binti one EFFENDY, and the last but not least, we also have Arina Dayana binti JUAZDY. Introduction of our policy. What is the health? Of course, among of you will know what it is, right? But I still want to tell, so listen carefully. As you guys can see in the slide, health is defined as a state of complete physical, mental, and also social well-being, not just the absence of disease. Okay? This means that the healthcare is not only about treating illness, but also about improving an individual's overall quality of life. For your information, quality healthcare is very, very important because it directly affects patient safety, treatment effectiveness, survival rates, and also overall health outcomes. Now, I want to tell you guys that in Malaysia, the Minister of Health that introduced the National Policy for Quality in Healthcare, or known as NPQH, which was officially launched on 5th October 2021 by the Director General of Health, which is Tan Sri Datuk Sri Dr. Nur Hisham Abdullah. His name very popular at COVID-19 era, right? So this policy guides both the public and the private healthcare sectors in improving healthcare quality from 2022 to 2026. Based on the 7 key themes, the NPQH can be understood as a national framework or guideline that sets the direction for how healthcare service should be delivered in Malaysia. You know what? It also ensures that the healthcare is safe for patients, effective in treatment, and focused on patients' needs, also known as a patient-centered care. In addition, the NPQH emphasizes continuous quality improvement, meaning that the healthcare providers must always evaluate and improve their service over time. It also promotes standardization so that the patient receives consistent quality of care across different hospitals and healthcare facilities. Overall, the NPQH plays an important role in strengthening the healthcare system by ensuring that all healthcare providers follow clear standards and work towards delivering high quality and safe service. Malaysia also practices a dual healthcare system consisting of the public and private sectors. As you see and experience, the public sector is more affordable but often face overcrowding, right? While the private sector provides faster and higher quality service but is more costly. So this difference creates several challenges, including the long waiting time, having workload among healthcare staff, and also inconsistent quality of care. So therefore, improving the quality and safety of healthcare service is essential to reduce risk and ensure the better patient outcomes. Now, I will explain the selected program, which is the Patient Safety Program, or PSP. The PSP is implemented by the Ministry of Health Malaysia under the National Policy for Quality in Healthcare, NPQH, like I mentioned just now. It is a national initiative designed to improve patient safety and reduce risk in the delivery of healthcare service, especially in the public hospitals. The program provides a structured approach to ensure that the patient safety is consistently practiced in the healthcare setting. It focuses on several key areas, including proper patient identification, effective communication among healthcare professionals, safe medication administration and infection prevention, and also control and reduction of patient injuries such as falls. So you guys see, right, that these focus areas as clear standard that the healthcare workers must follow in their daily practice. You guys know, in simple terms, the PSP can ensure that the patient safety is not just a theory, but it actually applied in a clinical situations. Patient safety is also refers to the prevention of error, harms, or adverse effects that may occur during medical treatment. For your information, medical error can happen due to various reasons such as human error, poor communication, heavy workload, lack of proper guidelines, or even system and technology issues. In Malaysia, these challenges are more serious due to high patient demand, overcrowding in public hospitals, and limited resources. For example, that I would like to take is hospitals like Sungai Buloh often experience a high number of patients, especially in emergency departments, which may lead to delays in treatment and increased risk of errors. So from that, to address these issues, the PSP implements several important strategies. These include the use of standard operating procedure, or known as SOP, clinical guidelines, and structured incidents reporting systems. Through this system, healthcare staff are encouraged to report error, near misses, or accidents so that improvement can be made. The program also introduced specific safety practice, such as the use of surgical safety checklists and the 5 rights of medications. This to ensure correct medication is given to the right patients. In addition, the PSP promotes a strong safety culture within the healthcare organizations. This includes teamwork, effective communication, and a no-blame culture, where healthcare workers can report mistakes without fear of punishments. So you guys clear what I say, right? So overall, the patient safety program plays a crucial role in improving the quality of healthcare service, reducing medical errors, and also ensuring safer treatment for patients in Malaysia. That's all from me. I would like to pass for the next session to Khalida.
Thank you, SYULIANA, for a very good explanation on introduction and the program part. Now, I am NURKHALIDA and I will be presenting the policy problem. There are three main policy problems identified in the National Policy for Quality in Healthcare, Npqh. And the first one is overcrowding and long waiting times in public hospital. The main issue here is that public hospitals in Malaysia are facing very high patient demand, which lead to overcrowding and eventually cause long waiting times. This happens because public healthcare is more affordable and widely used, but the system capacity is limited. For example, at the Hospital Kuala Lumpur, patients often have to wait several hours before receiving treatment, especially in emergency department and also clinics. This clearly shows how serious congestion can be in major hospitals. In terms of the causes, one key factor is the over-reliance on public hospitals, even for non-critical cases. Many patients choose hospital services instead of primary healthcare clinics, which this can increase the burden on hospital. In addition, inefficient patient flow and also management also can contribute to the delays. The impact of this issue is significant. Overcrowding could lead to delays in treatment and also reduce patient satisfaction. It can also affect the overall quality of healthcare services. So, this issue needs to be addressed to ensure a more efficient and safe healthcare system. So, from the first issues, we can see that overcrowding puts a lot of pressure on the healthcare system and affects service delivery. This situation is closely related to the next problem, which is the shortage of healthcare workers, as limited staff make it harder to manage patient demands. Therefore, I will now move on to the second policy problem, which is the shortage of healthcare workers in public hospitals. The main issue here is that Malaysia is facing a lack of doctors, nurses and also other healthcare personnel, which directly affects service delivery. Without sufficient staff, it can become really difficult to implement healthcare policies effectively, including patient safety program. For example, at Hospital Sultanah Aminah in Johor Bahru, doctors have been reported to handle up to 80 patients per day, which shows how heavy the workload can be due to staff shortage. Looking at the causes, one major reason is that many healthcare workers are leaving the public sector for better opportunity in private sector, mainly due to higher salary and also better working condition. In fact, thousands of healthcare workers resigned between 2022 to 2024. All of this create an imbalance in workforce distribution. The impact of this problem is very serious. Healthcare workers may experience burnout and also exhaustion, which can increase the risk of medical errors and also reduce the quality of care. At the same time, patients may face longer waiting times and also delays in treatment. Overall, the shortage of healthcare workers can weaken the healthcare system and also make it harder to deliver safe and efficient services. Now, let's move on to the third policy problem. The third policy problem is limited infrastructure and hospital capacity. The main issue is that many public hospitals are facing limitation in beds, wards, medical equipment and also space, which all of this can affect the service delivery. When the number of patients exceed the available capacity, hospitals often struggle to provide timely and effective treatment. For example, in Hospital Sungai Buloh, Hospital Sungai Buloh has experienced situation where additional beds has to be placed outside the wards during the peak period, showing that the hospital is operating beyond its capacity. One of the main causes is that the rapid increase in population and healthcare demand is not matched with the sufficient development of facilities and also infrastructure. In addition, budget constraint and slow expansion project also contribute to this problem. The impact of limited infrastructure is very significant. It can lead to the delays in patient admission, overcrowded wards, and reduced quality of care. In some cases, patients may need to wait longer for bed and also for treatment, which all of this can worsen their health condition. Furthermore, this issue also puts additional pressure on healthcare workers as they have to manage more patients with limited resources. So without adequate infrastructure and capacity, it is difficult for the healthcare system to function effectively and deliver high quality care. Overall, all of these three policy problems, which is overcrowding, shortage of healthcare workers, and also limited infrastructure, are closely interconnected and significantly affect the quality and efficiency of healthcare service in Malaysia. Addressing this issue, it is essential to strengthen the healthcare system. With that, now I will pass to the next presenter to explain on the next part, which is policy objective.
So, my name is HAZIRAH. Now, let's talk about their objective. The first objective is patient safety. Patient safety means ensuring that patients are not harmed during healthcare treatment. For example, in Malaysia, the Ministry of Health emphasized the use of SOP, clinical guideline, and evidence-based practices. Healthcare provider must follow proper procedure to avoid errors such as wrong medication or infections. In addition, incident reporting systems are used to identify risks and improve safety through corrective action. So, the second point is equity of access. Equity of access means everyone has the same opportunity to receive healthcare regardless of their background or locations. For example, in Malaysia, efforts are made to reduce the gap between urban and rural areas through rural clinic, mobile health services, and outreach programs. Telemedicine also help patients in remote areas consult doctor more easily and improving overall access to healthcare. So the third one is patient-centered care. Patient-centered care is focused on patient needs, value, and preferences. Healthcare providers are expected to communicate clearly, show empathy, and involve patients in decision making. Patients are given information about their condition and treatment options so they can make informed choices. Feedback systems are also used to improve service quality and patient satisfaction. So let's move to their strategy. So this strategy focuses on improving healthcare worker skill and knowledge to ensure safe and effective patient care. In Malaysia, the Ministry of Health provide continuous training such as workshop and seminar to update staff on current medical practices. Healthcare workers also share knowledge through teamwork and guidance from senior staff to improve patient care. In addition, performance is monitored through audit and feedback system to identify weaknesses and support continuous improvement. Next, educate resources. Educate resources are important to ensure healthcare service run efficiently. The Ministry of Health provides funding facility to support hospital. For example, Hospital Kuala Lumpur has advanced equipment for treatment. However, there are challenges like overcrowding in urban hospital and limited services in rural areas. That's why continuous investment and improvement are needed. Last is quality culture. A quality culture means healthcare workers always aim to improve their services. In Malaysia, organizations like the Malaysian Society for Quality in Health ensure hospital for quality standards. Healthcare staff also attend training and participate in improvement programs. For example, patient safety campaign help reduce medical error and improve service quality. This can build trust between patient and healthcare provider.
Assalamualaikum everyone. My name is NURSYAZA SYAUFI. For now, I will present to all of you about the strengths and weaknesses of policy evaluation. First, the policy helps to improve service delivery and reduce error. Systems like the medication error reporting system allow healthcare staff to track and analyze mistakes. This encourages evidence-based clinical decision and reduces wrong diagnosis or treatments. At the same time, it promotes continuous learning from past incidents. For example, studies show that a structural error reporting system can reduce repeated clinical mistakes and help hospitals identify root causes more effectively. Next strength is the policy establishes standardized safety guidelines. Through implementation of clinical practice guidelines and standard operating procedure, healthcare services become more consistent. This reduces variation in treatment and improves patient outcomes. Also, it allows performance monitoring using KPIs and benchmarks. Evidence shows that hospitals following these guidelines tend to provide safer and more consistent care. Finally, is the policy enhance safety culture among healthcare workers. It promotes openness, accountability, and teamwork. Healthcare staff are encouraged to participate in training, continuous professional development, and safety programs. Most importantly, it creates an environment where staff feel safe to report mistakes without fear. Research shows that a strong safety culture improves communication and reduces adverse events. In Malaysia, training programs under Npqh have also improved healthcare quality. For the weaknesses of policy evaluation is, firstly, there is a shortage of healthcare workforce. Many hospitals face insufficient numbers of doctors and nurses. This can lead to heavy workloads and burnout. This affects efficiency and increases the risk of medical errors. For example, contract doctors protest in Malaysia. They highlight real staffing issues, while the global data show a significant shortage of healthcare workers in the future. Secondly, the policy faces limited funding and resources. Budget constraints restrict investment in technology facilities and workforce development. This often leads to overcrowding, longer waiting times, and reduced service quality. For example, public hospitals like Hospital Kuala Lumpur frequently experience overcrowding, and global reports identify funding as a major barrier to quality healthcare. Lastly, there is a lack of compliance with SOPs and clinical guidelines. Not all healthcare workers consistently follow established procedures. Differences in training, awareness, and workload can affect compliance. This can result in medical errors, inconsistent treatment, and reduced patient safety. Even systems like the medication errors repository system depend on proper adherence and may be less effective if procedures are not followed correctly.
Hi, my name is Arina Dayana PT JUAZDY. Now, I will present the recommendations to improve the efficiency of the Npqh and the Malaysian healthcare system. As you guys can see at the first point, which is to increase the healthcare workforce. So, the first recommendation is to increase the number of the healthcare professionals in Malaysia. So, this is important because sufficient staffing is needed to ensure the efficient healthcare service in public hospitals. At the moment, many hospitals are facing shortage of doctors and nurses, which cause excessive workload among existing staff. This situation can lead to the fatigue and increase the risk of medical errors. Therefore, the government should recruit more healthcare workers and also improve their working conditions. This includes offering the better salaries, job stability, and career development opportunities to attract and retain skilled professionals. For example, we have hospitals such as Hospital Kuala Lumpur experience a high number of patient and staff shortages, which leads to the long waiting times and delay the treatments This shows how understaffing directly affects the quality and efficiency of healthcare service. In addition, continuous professional development programs should be provided to ensure the healthcare workers remain competent and updated with the latest medical knowledge. Let's move to the second point, which is expand healthcare infrastructure. The second recommendation is to expand the healthcare infrastructure in Malaysia, such as building the more hospitals and clinics to meet the increasing demand for the healthcare service. At the present, many public hospitals are overcrowded with the limited beds and insufficient facilities. This situation results in the long waiting times and reduces the comfort for the patients. Therefore, increasing the number of the hospital beds and upgraded medical equipment is very important to improve service efficiency. Furthermore, developing healthcare facilities in rural and high-demand areas can help reduce the pressure on our major hospitals in urban areas. For example, the Ministry of Health Malaysia need to expand hospital facilities and increase the healthcare resources, including the need for more nurses and medical staff. This clearly shows the infrastructure development must go hand in hand with workforce expansion to ensure a balanced healthcare systems. By improving the infrastructure, healthcare workers can also perform their duties more effectively in a better working environment. Now we move to the last recommendation, which is to strengthen the training programs and reinforce clinical guidelines in healthcare facilities. Continuous professional development, or we call as a CPD, should be actively implemented to ensure the healthcare workers maintain the high competency levels throughout their careers. Regular training such as workshops, simulations, and skill-based sessions can improve their knowledge and practical skills. In addition, the standard operating procedures, or we call as a SOP, and clinical guidelines must be strictly followed to standardize the healthcare practice. This is important to reduce the inconsistencies in treatment and minimize the medical errors. Monitoring and evaluating healthcare workers after training is also essential to ensure that these programs are effective and produce the positive outcome. For example, we have the Ministry of Health Malaysia that has introduced the structured training programs, digital system, and ongoing professional development initiative to improve service delivery. These efforts have helped enhance the efficiency and improve the patient safety in Malaysia. Now, let's move to our last content of our presentation, which is the conclusions. The Npqh and PSP implemented by the Ministry of Health Malaysia play an important role in improving the quality, safety, and efficiency of healthcare service in Malaysia. These policies focus on the patient-centered care and also promote the standardized practice such as SOP and reporting systems. As a result, they help to reduce medical errors and create a safer healthcare environment for the patients. However, despite these improvements, there are still several challenges that need to be addressed. Public hospitals in Malaysia continue to face issues such as overcrowd, long waiting times, shortage of healthcare professionals, and limited healthcare facilities. These challenges not only affect the efficiency of healthcare service, but also reduce the patient satisfaction and overall healthcare quality. Therefore, continuous improvement are very important in order to strengthen the healthcare system. This includes increasing the number of healthcare workers, expanding infrastructure, and enhanced training programs. With effective implementation of these strategies and strong commitment from the government, Malaysia can achieve a more efficient, safe, and sustainable healthcare system in the future.